Would adding Medicare to the marketplace in rural communities build stability and competition in that market? Two senators think the answer is yes. We're talking about Medicare X plan. I'm Bryn McBride of ABC for Health. X stands for exchange. This is the Medicare Exchange Health Plan, introduced by Senators Kaine and Bennett, two centrist Democrats. We're not talking about a Medicare for all proposal, but we are talking about a public option that is part of a buy-in being added to certain marketplaces. Now, the proposal that is being discussed right now is to add a public option buy-in that uses Medicare's network, its doctors, its pharmacies, its prescription plans, but only to start in areas that only have one insurance company in their exchange. So those health professional shortage areas or rural counties that only have one insurer or one plan in their whole county. The idea, according to Senator Kaine and Bennett, is to add Medicare as one other option. Folks can choose whichever they want, the Medicare buy-in plan or the marketplace plan, the private insurance individual plan that was in that market. They can build competition among them, help stabilize a little bit, and give folks more options. But it doesn't end there. This is a plan that is supposed to grow over time, with Medicare then being an option for all marketplace plans by the year 2023. Lots of pluses and minuses to the plans, but they're looking at the reality of billing stability. This would be big for those rural areas that right now have very few options. The legislation is quite short. It's about 14 pages. We'll share a link to that in just a moment, but it includes a lot of detail for being a short plan. One of the suggestions also is to give authority to increase rural reimbursement rates. So if you're in a rural area and you're a health professional, you could see as big of as a 25% increase in the reimbursement rate you get in this Medicare plan. It gives networks negotiating power, and think of your Part D pharmaceutical plans to have more people in that to then have more power to negotiate and lower prices. The legislation as drafted right now also prioritizes innovation. You find the word innovation all throughout the legislation in terms of data collection models, in terms of premium setting, and in terms of payment methods. They're looking at new and innovative payment reforms in this legislation that adds Medicare to the marketplace. The public option alternative is one that protects the Affordable Care Act. This is how it's different from some of the other public option proposals and Medicare for all proposals we've seen in recent weeks. This one, instead of being an alternative to the Affordable Care Act, adds Medicare to the Affordable Care Act. Now, it would not be available for folks that already have Medicare as being age 65 and older, or those meeting a Medicare eligibility because of a disability or condition. This would be exclusively for those that might otherwise purchase insurance in the marketplace. So you would have to be eligible for a marketplace plan, meet the eligibility requirements of citizenship or lawful permanent residence, have all of the other qualifying conditions in terms of not having access to other minimum essential coverage. And if you look at the other eligibility that goes into the marketplace, it would be exactly the same for this buy-in plan as well. This is a bill that is being circulated. It is seeking bipartisan support. And we talk about it in terms of the centrist Democrats that proposed it because it is a different look than that public option that was proposed from a little bit more of a left perspective, like we saw with Bernie Sanders' Medicare for All proposal. You can read that 14-page bill. We also share with you a link to a bill summary, and there's also some articles coming out of the home state of one of the bill's co-sponsors. You can read some articles coming right out of Colorado of how the bill is being discussed locally. You can keep your finger on the pulse of issues like Medicare X and others by staying in the conversation with us here. You can visit us at our website at healthwatchwisconsin.org. Just share your healthcare stories, send us an email, or ask us a question. You can also visit us on YouTube. Go ahead and like or share the video, or go ahead and subscribe to their channel. Thanks for watching.